was very young when I first tested HIV positive. I did not understand the danger it meant.
If a woman is not coming back, then you don't know whether they are swallowing the pills. And if they are not taking the pills, then they are not going to have viral suppression. So they are basically more likely to transmit the virus to the infants.
There's actually not a uniform definition of retention for PMTCT. And therefore, it appears that each study, or to some extent, each country has to have its own definitions of retention.
The Ministry of Health measures retention as keeping women in care, independent whether they have had gaps in their treatment. So it's possible that women started, came for a couple of months, did not come back, and then after 6 months would come back again. The Ministry of Health would consider that as retained in care.
The country, using HMIS information and a more loose retention definition, I think reports about 86% retention on ART compared to 54% that we found.
The enormity of retention as an issue in Nigeria cannot be understated.
Part of the problem in itself is that we don't have very good data. Anecdotally, we have significant issues with women dropping out of the program, having very poor attendance, and that is why Nigeria has some of the most significant mother-to-child transmission rates globally.
Do patients have medicines 95% of the time? When you look at that over the 12-month period, we actually saw that an even lower retention rate of about 40%. Speaking about the retention definitions that we see out there, I think they're just the tip of the iceberg.